joining me right now for some explanation on this, I have epidemiologist Dr. Raywat Deonandan back on the show. Thank you for returning, Doctor.
Thank you for having me.
So when she says COVID-19 is much less likely to spread outdoors, what do we know?
This is actually a point of friction in my own household because my physician's spouse is not a fan of walking by joggers, and it doesn't bother me that much. But the controversy is in how much of a risk there is in being exposed to someone who might have the disease, who walks by you casually and who exhales in your vicinity. So here's the thing about respiratory diseases in general. There's a reason that colds and flus and other kinds of viruses like that are a bigger problem in the winter months. One of those reasons is the fact that we're indoors more. And so we're more likely to be in close contact with other infected individuals and sharing their breathing space for prolonged periods. Whereas during the summer months, you're more likely to be outside and having lesser close contact with people. That is one of the variables driving the transmission dynamic. So there are a suite of studies out there looking at who has been getting COVID-19 and how they've been getting it. And the science is still pretty unclear, but a pattern that is emerging is that most of the cases seem to have arisen from close contact indoors, around dinner, business meetings, long-term working beside someone for several hours at a time. And there isn't a lot of evidence for getting it from someone who's walking by you. So I err on the side of don't panic if someone casually exhales in your presence. You're probably fine.
Interesting. So physical distancing still matters when you're outside, but the idea is that it's just more difficult to transmit the virus?
That's right. So there's something to be said for something called infectious dose, and that is the amount of virus that you're exposed to. That's why possibly healthcare workers are more likely to get sick and to get sick in a more serious fashion because they're exposed to a lot of the virus for prolonged periods of time. Those of us more casually exposed, if we're exposed at all, are less likely to get an infectious dose that causes illness. I've advised people to think about it this way. There's a probability that you're going to be exposed to somebody with the virus. Let's say you go to the grocery store and someone walks by you and you're both not wearing masks for some reason. And that probability is low to begin with because the prevalence of the disease is now low in the province because we have locked down and driven the curve down. But even if you are exposed, the probability of getting the virus from that person is less than 100% because virus has to translate to you. And then if you do get that virus upon your person or on your mucous membrane, the probability of it creating an immune response that is problematic for you is also low. Multiply those three probabilities, and that's a low number. And so your chances of having a bad experience if you go outside and slip up in your distancing and slip up with your mask discipline is actually quite low. So I think it's a good idea to go outside as the weather improves. We need the exercise. We need the fresh air. We need it for our mental health. And in addition, there is a decreased probability of disease transmission if we are in a wide open space. Of course, stay away from people. Of course, keep your distance if you can. Of course, I think we should also wear masks if we can. I think joggers should wear masks. That's probably a responsible thing to do. So
you think joggers should wear masks?
Yeah, I think so. I think if for no other reason to make other people feel good. Yeah, reduce the panic. But
interesting.
The reason for wearing masks, remember, my mask protects you and your mask protects me. So if you walk through a cloud of virus, you're probably not safe because the cloth masks that we wear have a wide fiber width and viruses can slip through them. But if you are sick, your mask prevents you from pushing that viral load past the fabric because it's a windbreak. So if you're a jogger who happens to have the disease and you don't know it, and you wear a mask, you are less likely to give it to others with all your huffing and puffing.
Dr. Deonandan, when you say if you go through a cloud of the virus, I'm just wondering, what would create a cloud of the virus? Would that be somebody who is jogging, they have the virus, and then they cough, and then that would create a big enough area that you could describe it as a cloud?
You're making me regret my choice of words. That's going to instill some panic in people. I can't imagine a scenario in which a cloud of virus is produced.
Right, or just an area. I guess cloud is not a great word, but a burst of the virus, or a cluster of droplets of the virus.
Sure. A severely infected person who is virally shedding, who coughs, and a big mucousy, disgusting cough in your vicinity, in a space with low humidity that allows the droplets to linger in the air for a bit of time. Yeah. So a lot of factors have to be in place for that cloud to exist.
Right. There's a lot of timing here everything has to go right for this to happen.
That's right. Again, this is not to say you shouldn't be careful. This is not to say that we should reduce our social distancing. That's going to be critical in the months to come. It's just to say you shouldn't panic. We should stop being afraid of our fellow people. That's not a way to live our lives.
I saw a woman the other day jogging with a mask on, and honestly, doctor, I thought she was going to collapse. She looked like she was having a hard time breathing through that thing. I think common sense guidelines here do apply. If you are going to be running and you think there's other people around, maybe wear a mask, or go at a time when it's 8 or 9 o'clock at night and cross the street, or give people a really wide berth so you're not even anywhere near them.
That's absolutely true. We're citizens here. We all share a society. Let's try to be good to each other, and that involves respecting people's fears.
Finally, just before I let you go, Doctor, I want you to give me your personal stance on wiping down groceries. In our household, we've been meticulously, painfully wiping down every single thing, the stuff that is perishable, it has to go in the fridge, because my partner is very strict. The house is the clean zone. Nothing comes in unless it's been wiped down. However, the non-perishables, stuff that doesn't have to go in the fridge, we put down in the basement. And then we don't have to worry about wiping that down. I've been seeing conflicting reports from various scientists and doctors on this. How important do you think it is to wipe down groceries when they're coming into the house?
We do exactly the same thing in our house. Again, I have a physician spouse who is quite adamant about these things, so I do whatever she tells me to do. And I feel, frankly, that it's a bit of an overkill, but I think it's also better to err on the side of caution. It doesn't cost you anything to take those extra steps for your peace of mind. And if you can be confident that your house is a safe zone, why do you want to pollute your house? Why not have an area that you can live in where you can be completely confident that you are safe? And all it costs you is a couple of extra minutes per day when dealing with your items.
All right, Dr. Raywat Deonandan, thank you so much for coming on the show. Appreciate it.
Thank you.